If you can let folks in.
Here they come.
Good morning, and thank you for joining our weekly COVID-19 briefing. As always, we're joined by Health Commissioner Dr. Cheryl Bedical. Today's briefing is for press only, but as usual, we are live streaming on the Health Department's YouTube channel. Members of the public are encouraged to check the Health Department's social media accounts for the link to the briefing. Today's briefing will run until 10:30. As usual, we will present remarks first in English, then in Spanish, then I'll open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions and that we limit questions to 3 or fewer. Please keep your questions focused on the topic of the COVID pandemic and the city's response to it. With that out of the way, Dr. Bedical, would you please start us off?
Good morning, everyone, and welcome back to our weekly COVID briefing. I wanted to note that we're seeing the COVID situation continuing to improve, but we're not out of the woods yet. As of yesterday, we're seeing an average of 554 new cases of COVID per day compared to just about 1,000 cases per day last week. So that's a 50% drop in cases in just 1 week. We're down nearly 85% since the peak. The percentage of tests that's coming back positive is now down to 7.3%. The last time we saw a percent positive that low was December 21st. Yesterday, we reported that 686 people who have tested positive for COVID were in Philadelphia hospitals. That number is less than half of what we saw at the peak of the wave 2 weeks ago. Looking at vaccines, we know that more than 95% of adults, 89% of those 12 and up, and 46.7% of children 5 to 11 in Philadelphia have had at least 1 dose. 78.9% of adults, 73.1% of those 12 and up are fully vaccinated, and nearly 30% of adults have received a booster dose. With the numbers out of the way, now is a good opportunity to take a step back and look at how things are going overall. The last 6 weeks have been extremely difficult, but now we've seen our case rates fall by about 50% each of the last 2 weeks. If things continue the way they are, we could start to see things getting back to some semblance of normal. But first, we're still in the CDC's high level of community transmission. Things are still bad out there. That means that we should still continue to do what we know works. Double mask or wear an N95 or a KN95 mask when indoors around others. Stay home if you're sick or you've been exposed to someone with COVID, and try to avoid crowded indoor areas. And please get vaccinated. The Omicron wave has shown us how quickly things can get bad again. And Omicron also showed us how much better people who are up to date on their vaccines were protected. According to the CDC, having a booster dose reduced the likelihood of being admitted to a hospital during the Omicron wave by 90%. However, people who were fully vaccinated more than 6 months ago but had not yet had their booster were only about 38% protected. But most Philadelphians, including many people who are over 65 or have underlying health conditions that put them in high risk, still need their boosters. With Omicron still circulating in the city and still just as contagious, that means they are still at high risk of hospitalization, long COVID, and even death. So please talk to your family members, your neighbors, your friends about getting boosted. Listen to their reasons for waiting and see if you can help them to get the answers they need if they still have questions. Finally, the FDA recently announced that they'll begin reviewing data on a COVID vaccine for children between 6 months and 5 years old. We're very excited to have young children start to get their protection, but we can't just have little babies and toddlers showing up at pharmacies to get vaccinated. The rollout for that vaccine will be quite different than what we've been doing for the last 13 months. It could actually end up looking like how our children get their routine vaccinations against measles, varicella, and polio now. We're already working on how that will work, so we'll be ready for when the FDA says it's ready to go. To sum up, there's lots of good news on the horizon, but keep wearing your mask, avoiding crowded areas, and staying home if you're sick. And together we can find our way back to normalcy with the help of vaccines and boosters. If you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Sally to present these remarks in Spanish.
Buenos días. Y bienvenidos a nuestra sesión informativa semanal sobre COVID. Quiero señalar que estamos viendo que la situación de COVID continúa mejorando, pero aún no estamos fuera de peligro. Hasta ayer, estamos viendo un promedio de 554 nuevos casos de COVID por día en comparación a 1,000 casos por día la semana pasada. Eso es una reducción de 50% de los casos en solo una semana. Y hemos bajado casi 85% desde el pico. El porcentaje de pruebas que están dando positivas se ha reducido a el 7.3%. La última vez que vimos un porcentaje positivo de ese mínimo fue el 21 de diciembre. Ayer informamos que 686 personas que han dado positiva por COVID estaban en hospitales en Filadelfia. Este número es menos de la mitad de lo que vimos en el pico de la ola hace 2 semanas. En cuanto a las vacunas, sabemos que el 95% de los adultos, el 89% de los 12 años en adelante y el 46.7% de los niños de 5 a 11 años en Filadelfia han recibido al menos una dosis. El 78.9% de los adultos y el 73.1% de los mayores de 12 años están completamente vacunados y casi el 30% de los adultos han recibido una dosis de refuerzo. Con los números fuera del camino, ahora es una buena oportunidad para dar un paso atrás y ver cómo van las cosas en general. Las últimas 6 semanas han sido extremadamente difíciles, pero ahora hemos visto que nuestras tasas de casos han caído aproximadamente un 50% últimas de la semana pasada. Si las cosas continúan como están, podríamos comenzar a ver que las cosas vuelven a cierta apariencia de normalidad. Pero primero, todavía estamos en el alto nivel de transmisión comunitaria de la CDC. Las cosas siguen siendo malas por ahí. Eso significa que debemos continuar haciendo lo que sabemos que funciona. Doble máscara, o usar una máscara de N95 o usar una máscara de KN95 cuando esté en interiores cerca de otros. Quédese en casa si se siente enfermo o ha estado expuesto a alguien con COVID y trate de evitar las áreas interiores abordadas. Y por favor, vacúnense. La ola de Omicron nos ha demostrado lo rápido que las cosas pueden volver a ponerse mal. Y Omicron también nos mostró cuántas personas que están al día con su vacuna estaban mejor protegidas. Según la CDC, tener una dosis de refuerzo redujo la probabilidad de ser admitido en un hospital durante la onda de Omicron en 90%. Sin embargo, las personas que fueron completamente vacunadas hace más de 6 meses, pero que aún no habían recibido su refuerzo, solo estaban protegidas un 38%. Pero la mayoría de las habitantes de Filadelfia, incluidos muchas personas que tienen más de 65 años o tienen afecciones de salud subyacentes que los ponen en alto riesgo, todavía necesitan sus refuerzos. Con Omicron todavía circulando en la ciudad y aún igual de contagioso, eso significa que todavía están en alto riesgo de hospitalización, COVID largo e incluso la muerte. Así que por favor, con los miembros de su familia, sus vecinos y sus amigos acerca de ser impulsados. Escuche sus razones para esperar y vea si puede ayudaros a obtener las respuestas que necesitan si todavía tienen preguntas. Finalmente, la FDA anunció recientemente que comenzará a revisar los datos sobre una vacuna COVID para niños entre 6 meses y 5 años de edad. Estamos muy emocionados de que los niños pequeños comiencen a recibir su protección, pero no podemos simplemente tener bebés y niños pequeños que se presenten en las farmacias para vacunarse. El despliegue de esa vacuna será bastante diferente de lo que hemos estado haciendo durante los últimos 13 meses. En realidad, podría terminar pareciéndose a cómo nuestros hijos reciben sus vacunas de rutina como la de sarampión, la de varicela y la de polio. Ya estamos trabajando en cómo funcionará, así que estaremos listos para cuando la FDA diga que está lista para comenzar. En resumen, hay muchas buenas noticias en el horizonte. Siga usando su máscara, evitando áreas concurridas y quedándose en casa si está enfermo. Y juntos podemos encontrar nuestro camino de regreso a la normalidad con la ayuda de vacunas y refuerzos. Si desea obtener más información sobre la pandemia y la respuesta de la ciudad, puede visitar nuestro sitio web en phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Gracias. Thank you very much.
Thank you very much, Zoe. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function, and we'll take those questions in the order received. As noted earlier, we ask that media outlets coordinate internally and keep their questions focused on today's topics. If there are any reporters who do not get the opportunity to ask a question or have questions about other topics, please follow up with us by email and we'll get you an answer. First up, we're going to go to Mike D'Onofrio from Axios Philly. Go ahead, Mike.
Thanks. Is the administration considering dropping the mask mandate like in San Francisco? Why or why not?
Not at this point. So we still have more than 500 cases per day. We are on track to see 300 deaths in January. We are not at a point where we would drop the mask mandate. Eventually, absolutely, but not at this time.
And then can you just tell me what circumstances would have to be in place for you guys to consider dropping the mandate, for businesses, restaurants, gyms, et cetera?
So our team is actively discussing what an off-ramp looks like. It's complicated by the fact that more people will be doing home tests, which is great, but just counting cases won't give us full information. Hospitalizations are a better metric, but we know that some hospitalizations are for COVID and some hospitalizations are with COVID. Deaths are, a very strong metric, but we get that data delayed. So it's going to be some combination of those things. But, if you think about where we are with this particular wave and case rates right now, we're probably several months away from a place where we'll have the kind of safety to drop all the current restrictions.
All right. And then just lastly, are the free masks that are supposed to be available in pharmacies, grocery stores, stuff like that? There's like high quality ones, the KN95s, K95. Are those readily available yet in Philadelphia? And if not, when?
So I haven't heard yet that they are readily available. Last I heard they were coming soon. Happy to check on that and get back to you. That's a great question.
Yeah. Any update? I'd love to, tell our readers. So thanks. That's all I got for the noise.
Great. Thank you.
Thank you so much, Mike. Next up, we're going to go to Justine McDaniel from the Inquirer. Go ahead, Justine.
Commissioner, nice to see you. Two questions. The first, are you satisfied with the pediatric full vaccination rate? And can you explain to parents why young children should still get vaccinated even though they can't be boosted yet right now? Talk about that rate, please.
Sure. So, we've made real progress in the last few weeks on pediatric vaccinations, but no, the rate is not nearly high enough. So, as I mentioned, for 5 to 11-year-olds, we're at 46.7%. The rate for 12 to 17-year-olds is a little bit higher for first doses, but it's still not high enough. I can pull that for you. Overall, 12 to 17-year-olds, we're at 66% with the first dose. So that's still low enough that we're going to see a lot of spread between kids. And, we all know that kids in general do better with COVID, but there's a couple of things about kids. One, some kids have high-risk conditions, and kids are exposed to adults in their lives who themselves may have high-risk conditions, including just being older. So, children visit their grandparents and can easily infect them. Right now, about a quarter of our 65 and older adults in the city are not yet vaccinated. So there's a lot more work to do there. In terms of parents and what to tell parents, there's a few reasons to get your child vaccinated. One is just for your child's health. We don't know which children, which teenagers will go on to have long COVID. It's a thing you can do to help protect them, but it's also a thing you can do to protect their classmates, to protect the older adults in their life, and, to protect our whole community. So, I know it's tempting to wait for a lot of people. It's just one more thing to do. There's, a chance your child might have a little bit of fever, a little bit of discomfort. But on the other hand, you don't know which child in your child's classroom might have cancer, might have type 1 diabetes, might have severe asthma, might be at risk. And you don't want to be the parent who let their child spread this to a child who is themselves at high risk.
Justine, anything else?
Yeah, you noted, that soon we might see some getting back to normal, but also, of course, Omicron remains as contagious as always. So at what level of new cases per day or hospitalizations per day can people begin to relax? Is there a level folks should be watching for when they might feel okay indoor gathering? And do you have any projections of when we might reach there?
So we're working on developing that guidance right now. Omicron is so much more contagious. We still have more than 500 cases a day in the city and a positivity rate that's much better, but it's certainly not where we want it to be. So I think we're not there yet. We all have individual tolerance for risk too, and that's based on our personality to some degree, but also on, what's the health of our family like, and what kind of work do we do, and who do we get together with who might themselves be at high risk. So all of those things will go into that decision making. With the numbers we have today, I think we can all kind of look to a brighter future. We can see things are much, much better, but we shouldn't completely relax yet. We are going to try to put together some numbers for the city in terms of our specific recommendations over the next week or two, just to be able to put that off ramp out to people, but that's not quite fully baked yet.
Great, thanks so much.
Thank you very much, Justine. Next, we're going to go to Trish Hartman from Channel 6. Go ahead, Trish.
Hi, Dr. Bedigal. I have another question about children and vaccines. You mentioned in your initial comments that the rollout or distribution process for the younger children will look different from adults or some of the older children. Can you give us any more details as to what that may look like? Are you going to hold special clinics for younger kids, or are you going to do something in childcare facilities? Justine kind of asked about this, but in preparation for some hesitancy among parents, what is the city's strategy to reach those parents who are unsure if they want to get their children vaccinated? Thank you.
Sure. So for the under fives, there is a sort of infrastructure problem right now, which is that pharmacies are allowed to vaccinate down to age 3. And pharmacies have been incredibly effective partners at getting vaccine to people. If they, they're giving far more vaccine than any other group of providers at this point. They're open lots of hours. They're located all over the city. Many people find them very convenient to go for vaccines. But since they can't vaccinate the under 3s, And since we know that many primary care practitioners have not yet signed up as vaccine providers, we have potentially a real problem for the under 3s. So we're doing a lot of outreach right now to primary care providers about the fact that it's gotten much easier to provide vaccine than it was at the beginning of the pandemic. So practices that said no to the 70 below freezer, conceivably could say yes at this point, but we want to get information to them. If we can get lots and lots of primary care practitioners signed up and able to give vaccine, that's going to make this whole process a lot easier for parents. If you can get your child vaccinated at the regular office they go to when they go in for their routine appointments, or just make that extra appointment with your doctor, terrific. We are going to need some additional strategies, some additional vaccine clinics for young kids, and we're working out details on that right now. But clearly there'll be some practices that don't step up and don't get the vaccine, and those parents will need a place to go. So we're going to be working that out over the next few weeks while we're waiting for approval. In terms of how we convince parents, I think we all have to look at the data. And one of the things that I try to do and our health department tries to do for Philadelphians is to help interpret the data and let's look at the effectiveness numbers. Let's look at the risk profile of the vaccine in young kids and talk about that. Because I think that, if I had a young child under 5, that's what I would want to know is what's the risk for my child? What's the benefit? So we have to look at those numbers before we can start convincing people of it. But I think there's a lot of parents who would really like, if they feel comfortable with the vaccine, would like to find their way out of this constricted existence that a lot of us have right now as we try to protect people who are unvaccinated.
Just a quick follow-up. Can you give us some reasons why some of the pediatricians said no to being a vaccine provider? And is the city now reaching back out to those offices to try to get them to say yes?
Yeah, so, early on in the pandemic, we needed these ultra cold freezer units to store the vaccine. And so, there were a lot of offices that felt that was too cumbersome. For some offices, the reporting that's required by CDC that we have to require for providers was challenging. Lots of different pieces to this. It's not easy, but as we see this as a path back to normalcy, I think that's where we're trying to convince providers right now that they can be part of that. And ultimately, I'd love to see kids getting these vaccines at their normal pediatric visits. Hopefully this will become something that we can routinize and that it's just part of the normal vaccines of childhood. And then those children can go off and be protected. And we don't have to set up these huge networks of clinics all over the city. We can use our normal primary care networks.
Thank you.
Thanks so much, Trish. Last question, last person with their hand raised from Channel 10, Randy Gyllenhaal. Randy, why don't you go ahead?
Good morning, Dr. Bedigol. First question is, you mentioned it's several months away possibly from dropping masks. I want to ask about any concerns you have about prolonged masking of children. Many European countries don't recommend masks under 12. They haven't seen massive disparities. And CHOP's policy lab has just told us they're reporting Omicron cases among children are similar to other seasonal viruses, and they have some concerns about socialization and things like that. I'm wondering if that's accurate on your side as well about being similar to seasonal viruses, and what concerns you have about this maybe lasting through the school year for children.
Yeah, so in general, children have actually done really, really well with masks. Kids under 2.
I understand there's not much data yet that's peer reviewed on the socialization and other kind of outcomes of learning, especially for younger children and masks.
Yeah, well, kids under 2 can't wear masks. And so, one of the challenges in a daycare environment is if you do have kids who are contagious unmasked, the kids under 2 there's just not a way to protect them. So, in general, what's been seen with children of all ages is that they're quite resilient. They do very well with masking. Of course, we would all love to get rid of those masks, but we've also seen, and this is true in national data, international data, and we've seen it here in Philadelphia, just how protective masks are. I understand the CHOP Policy Lab perspective, but when we look across the city, we still see we have 250,000 adults who are still unvaccinated. We just saw our hospitals getting very, very close to being overwhelmed we're going to see hundreds of deaths this month. We're not yet at that place where we can say we can return to normal. So I hope to get there soon, but that's not what we're seeing from the data.
And then just on vaccine mandates, especially in light of this ruling from an arbitrator for Philadelphia police, I'm wondering, one, what led to the decision to push through on this mandate for police? They have some concerns from the union that they may be understaffed if this goes through. And then secondly, when it comes to like mandates for restaurants, say, there is some CDC data showing prior immunity holds up somewhat similarly to vaccines during Delta. And now that Omicron has kind of washed over, is the vaccine mandate reasonable moving forward? And separately on the police issue, concerns about staffing for those officers.
Yeah, so the data on vaccines overall is just much stronger on than the data on natural immunity. The problem with natural immunity is, firstly, it's not the same for each person. So there are some people who form strong natural immunity, some people who don't. And that's unpredictable in terms of who those people are going to be. And then it's not necessarily going to be lasting. So the data continues to show a very strong benefit, particularly against severe disease, hospitalization, and death for people who've been vaccinated. Certainly, there's some benefit from natural immunity. That's absolutely true, but you still get more benefit from the vaccination. In terms of the police, I would defer those questions to the mayor's office.
Okay, and just one follow-up, if possible. If the vaccine mandate for restaurants, do you see that being somewhat permanent, or would that be able to be removed amid a low transmission in the community?
I would not see that as permanent. It really depends where we are. And as we talk about off-ramp, that will be something that we definitely discuss.
Thank you.
Thank you very much, Randy. Seeing as we're out of questions, I'm going to end today's briefing. As a reminder, this briefing is usually held weekly on Wednesday mornings. Details on next week's briefing will be issued via media advisory. Thank you all very much for joining us today.